few videos, we have studied about the general principle involved in the management of poisoning, where we came across with 6 steps in the general principle, which included stabilization, evaluation, decontamination, poison elimination, antidote administration, nursing and psychiatric care. Up to now, we have completed all the 5 steps in general principle involved in the management of poisoning. Stabilization, which included with the assessment and management, where assessment of airway, breathing, circulation and depression of central nervous system, where we are going to manage respiratory insufficiency, circulatory failure, cardiac arrhythmias and central nervous system depression if observed with the patient, and followed with evaluation, where hypothermia, hyperthermia, acid-base disorder, convulsion, agitation, movement disorder, electrolyte disturbances, which includes hyperkalemia, hypokalemia, hypernatremia, hyponatremia, hypocalcemia. This is commonly observed because of the poison administration in the body. Also, we came across with the next step, where decontamination of the poison in the route which is exposed. The common exposure route which include eye, skin, gut, and also with the gut, various techniques will use in order to decontaminate it. Like emesis, we can go with gastric lavage, catharesis, activated charcoal and whole bone. Irrigation can be done with the unobserved poison. So in case of observed poisons, we have certain techniques like forced diuresis can be utilized depending on the nature of the drug. Manipulation in the urinary pH can be done in order to achieve the elimination of the poison from the body. Then if already the poison got absorbed into systemic circulation, we have extracorporeal technique which include hemodialysis, hemoperfusion, peritoneal dialysis, hemofiltration, plasmapheresis, plasma perfusion and cardiopulmonary bypass can be done in order to achieve complete elimination of the poison from the body. Along with this, when it is essential to take care of the patient by giving nursing as well as the psychiatric care. So let us see where this nursing care is essential. This nursing care is essential with the comatose patient. So this patient, so they cannot administer drug themselves wherever required, and they cannot express their requirements. In such condition, continuous care is essential, especially the nursing care, where the nurse plays an important role in a comatose patient in order to take care of such patients, because here as the patient cannot move themselves, they will be still. So in such condition, attention should be taken with the pressure points to prevent the development of diffuse ulcer. So how to overcome this means like hourly turning. A pillow can be placed between the legs, and if ripple materials are available, it can be used so that we can overcome this ulcer formation. So in the people, like spontaneous blinking is not observed with them, like the eye becomes still, absence of spontaneous blinking, there may be much chances of keratitis. So we can avoid exposure of keratitis by using methyl cellulose eye drops, and even if necessary, we can secure the eyelids with adhesive tape so that we can overcome this keratitis problems. So this can be achieved only by observing the patient, especially with the comatose patient. Nursing care is essential. So then followed with some other take caring of the excretory substances like urine, because the patient may frequently urine in the bed lining so that it may get soaked. It is essential to change the bed lining frequently, and also sometimes it may get stained with fecal material. So thereby nurse should take care with this. She is having a major role, and even urinary incontinence can be managed with the Schiller urinal for a male. So it's nothing but it's like balloon-like structure where the urine maybe get stored in that and it can be get replaced. For female, we have indwelling cyclic catheters which will be get inserted, but here aseptic condition should be maintained in order to prevent the infection. Then major common complication what we will come across is the inhalation of gastric content. It's a common problem which can be observed. It can lead to pneumonitis condition. So this can be prevented by positioning the patient in a semi-prone condition with a slightly dependent and intubating if necessary. So that way we can prevent pneumonitis where aspiration can be prevented. And also very essential is passive physiotherapy may be advisable to prevent the stiffness and muscle atrophy. And if any chances of getting infection, it is essential to give antibiotics as a prophylactic antibiotic wherever required. It should be administered by observing the condition of the patient. Next aspect, that is the psychiatric care. Nowadays, psychiatric care is very much essential and compulsory in many types of poisoning, because we know the reasons for poisoning. The poisoning may happen intentionally or unintentionally. Intentionally, people may require much counseling because there will be a chance of repetition of this suicidal gesture with them. It's essential to remove that suicidal gesture. It is only happen because of the psychiatric care. So a significant proportion of overdose may cause compressed suicide attempts. After medical stabilization, the most important aspect of management consists of psychiatric counsel in order to prevent recurrence of suicide ideation once the patient has been discharged. So now here, to whom the psychiatric counsel should be given. So it is essential to give suicidal counseling, psychiatric counseling to the family member and also with the patient who underwent the suicide. So now here, recognition that the patient is possible suicidal with precise analysis of the potential for suicide is essential. The main aspect here to identify the reason for committing the suicide. If you identify the reason, then it will become easier to treat the conditions so that further attempt for suicide can be reduced up. And carefully analyzing the patient psychological state, whether he got depressed, sometimes he may be uncooperative, unresponsive, and also agitated, anxious, and violent or psychotic. In such condition, this should be get identified early and it should be get treated out, because they may harm themselves also and they may also harm the family member also in future days. So that should be identified. This is possible only with the psychiatric care. So that it will allow for realistic appraisal of the psychosocial alternative with respect to the immediate and long-term treatment. Disposition and continued follow-up is required in such condition, because whenever the drug treatment during that time, the symptoms may not be observed with the patient, and psychiatric drug dosage fixation or stoppage of the drug should be done only under the supervision of the psychiatric doctor. Thereby, it is essential to take care of such patient under psychiatric care. And at sometimes outpatient also may require counseling, so this can be achieved by repeated visiting with the psychiatrist. So now coming with the psychosocial assessment, it's become an important aspect nowadays, because now comprehensive evaluation is essential in the toxicological emergencies. In comprehensive evaluation, a team of the physician will be working together in order to treat the reason for poisoning, and the treatment of poisoning simultaneously will be happening. So So it is essential to initiate in every case of poisoning, especially if it is found that suicide is the reason for poisoning. It is essential to implement the psychiatric care in all the conditions. So now here interviewing with the collateral sources. Collateral sources here it may be the family member who are accompanying with the patient, or sometimes it may be the friends who accompanied the patient. So thereby we can have a talk with them, and further attention of suicide can be prevented in such condition. Sometimes it is preferable to have discussion with the family member or friends only, by not taking patient himself in the counseling. So sometimes like delay in obtaining psychosocial information can lead to some serious social consequences, because once the patient got treated with the poison, so he may be get discharged to the home, so that in the family there may be chances like small children may be available, so that they may be get harmed because of the untreated symptoms which was observed during the poisoning condition. So thereby psychiatric care is essential, and it should be get continued after for discharge also. Counseling session should be continued once the poison treatment have been done. So this all about the psychiatric care. So up to now we had in detail discussion about the general principle involved in the management of poisoning. As rightly I was quoting about the antidote administration. For all type of poisoning we may not be having antidotes, but survival rates are high without antidotes. That's only possible because of the general principle what we are using, that's called as general management principle. That's a compository technique what we will be using, which include the 6 principles. With the help of this supportive care technique, any type of poisoning can be get treated, even though antidotes are available, but it depends on the time of visit to the hospital. That's why it is essential to bring the patient in a right time, that is as fast as possible, so thereby the treatment can be started. So in the coming videos we will be utilizing this general information what we have studied under general principle involved in the management of poisoning, and we will take some common examples of various poisoning which is encountered during the clinical rounds, and let us try to implement this general principle involved in the management of poisoning in particular type of poisoning.